So I wanted to make a video to talk more in depth about the condition PCOS, polycystic ovarian syndrome. It is probably one of the most common things I'm seeing in my practice. It's so prevalent today, about 10 to 13% of the population they estimate has PCOS. And it's something that can play a big role in fertility as well. I thought I would go into a little bit more depth about what is PCOS, what's the physiology behind it, what is the treatment kind of approach that someone would take with PCOS to help support symptoms and to improve someone's overall health and quality of life. Again, this video is only for informational purposes. I'm not here to treat or diagnose you. So please see your own doctor if you are experiencing symptoms or you think you might have PCOS. It is snowing here today, and I thought I would sit by my window in our little breakfast nook. I find it's nice to be at least near some natural lighting while I'm doing work. Because it's just so cold to be actually outside right now. So let's talk about it. PCOS stands for polycystic ovarian syndrome. This is the most silly named syndrome ever because it implies that somebody needs to have cysts on their ovaries in order to be diagnosed, but that is not the case. Now we have something called the Rotterdam criteria that we use to diagnose PCOS in most situations. And in order to be diagnosed, someone has to meet at least 2 out of 3 of these things. So number 1 is having cysts on ovaries. So on an ultrasound finding, there's a specific finding on the ovaries where there's sort of multiple follicles that are developing, and they're kind of in like a pearl-like structure around the ovaries. This is referred to polycystic ovary syndrome. Poly means many, so many cysts on ovaries. This isn't always found though. So someone may not have this finding on ultrasound and could still have PCOS. So the other 2 criteria are having signs of hyperandrogenism. So hyperandrogen means high levels of androgens, high level of testosterone. That's sort of the male dominant sex hormone. And in PCOS, the levels of these are much higher than they should be in a female. And that leads to symptoms of acne, hair growth, something called hirsutism, which is like a male pattern hair growth. It typically presents in like the male pattern. So like a beard can also be present on the body, like nipple, chest, low back area. And acne also would have, more of a specific presentation where it's a more resistant type of acne. It's typically, that hormonal kind of picture can even go down to the neck, to the chest. Some people have it on the back as well. The third criteria is that somebody would have anovulation, so irregular menstrual cycles. Typically, most common, we see this as having like long cycles. So somebody's cycle is over 35 days. They'll have a period, then they maybe miss a month, and they have it again. So it's more on that range of having longer cycles, but it can certainly also present in other ways. Someone needs to meet 2 out of 3 of these criteria to be considered to have polycystic ovarian syndrome. However, there is sort of a nuance to the diagnosis because certainly other things can present with those symptoms and would not be PCOS. So the most common one that I see, and I have to differentiate within using blood work and really doing a thorough history, is actually hypothalamic amenorrhea alongside acne. So presentation-wise, the person comes to me, they also have irregular cycles and they're not having a regular menstrual cycle, and they also have acne. The difference between these 2 people I usually see is that the person with hypothalamic amenorrhea is usually because somebody is under eating, so they're not eating enough, their nutrition is poor, it's not sending the signal that the person is safe, or that their stress levels are so high and that is reducing the signal from the brain to the ovaries. This person's typically, maybe excessively exercising, excessively not eating enough. They might be more on the thin side. And another thing that is much different between these people is that in the PCOS patient, a very dominant factor is insulin resistance. So this is where blood work also really comes in handy because we can test things like, what is somebody's HbA1c? What does their blood sugar look like? How is their body processing blood sugar? Do they have elevated insulin levels? Hyperinsulinemia, we'll get into it a bit more, but that is a huge driving factor that's involved in PCOS. That's why it's important to actually work with a clinician. Hypothalamic amenorrhea is just the one that I find I'm most commonly differentiating between, but there's also other conditions, hormonal conditions that can also look like PCOS. but are actually something else. There are three sort of underlying mechanisms that research has found to kind of be involved in this PCOS process. So the first one is called the central gonadotropin theory. So this is a theory basically about how the brain is communicating to our ovaries and regulating the menstrual cycle. In PCOS patients, we see that this process is dysregulated. And so the brain is sending out sort of irregular pulses. And instead of sending out follicle stimulating hormone each month to ripen and mature one follicle to then ovulate an egg, it is sending out more of the hormone luteinizing hormone. So we see on blood work elevated levels of LH to FSH than normal. And this production of LH over FSH is also leading to an increased production from the ovaries of androgens. So we have a higher production of androgens, those testosterone hormones, and we are not getting the maturation that we need to ripen the follicle and produce a healthy ovulation. The other theory is called the ovarian stereogenesis theory. In this theory, they suppose that people with PCOS have an altered level of actually producing androgens within the ovarian cells themselves. So there's something about these individuals that is making more androgens from these cells than we otherwise normally should have. And all of this links back to insulin resistance. So in PCOS patients, we most commonly see insulin resistance, and this is playing a big role in the alteration of the hormone functions and why we're getting kind of this presentation happening and why we have such high levels of androgens. So high levels of insulin can influence PCOS in a number of ways. For one, high levels of insulin can lead to higher production of those androgens from the ovarian cells and also from the adrenal glands. But another way is that high levels of insulin can also disrupt the liver's production of a hormone called sex hormone binding globulin. And this hormone is responsible for binding testosterone and inactivating it in the blood. And instead, in PCOS, sex hormone binding globulin is low. So therefore, we have further active testosterone floating in the bloodstream. So it's this complete picture of higher testosterone, higher androgens, just overall stimulation of more androgen production from many outputs of the body. Sort of this vicious cycle of somebody who has high levels of insulin, high levels of androgens, low sex hormone binding globulin, and together these things keep reinforcing each other. Other factor that is involved in this is inflammation. So we see higher levels of inflammation in patients with PCOS, and inflammation we've seen can disrupt this brain communication with our ovaries. It can lead to more disruption in that pulse from our brain, and therefore further disrupt the ovulatory cycle. It can even further disrupt follicle maturation, and higher levels of insulin and inflammation, they typically go hand in hand together. And the more inflammation we have, the more insulin resistance we have, and the two can kind of keep feeding each other as well. So targeting inflammation and targeting insulin is a huge part of the picture when we're talking about PCOS and how we can manage and treat this condition. Having PCOS is also associated with other serious health outcomes like higher incidence of type 2 diabetes, higher levels of dysregulated cholesterol levels, hypertension, subfertility. It can really impact fertility because we need ovulation to happen in order for fertility to take place. There's also a risk of endometrial cancer with PCOS because somebody is going with many cycles, 6 months without getting a menstrual cycle, then we can get what's called endometrial hyperplasia. So our endometrium lining is not being shed each month, and this puts us at risk for irregular cells to develop, and eventually that could even progress into cancer. So that's one case where it's really important to seek a doctor's care if you are not getting your period regularly, because we can initiate something called a withdrawal bleed. We can use hormones to allow your body to shed the lining even if you are not getting a cycle each month. So that was the scary stuff. That was the serious stuff. Now let's talk about what we can do about it. What can we do from a natural, from a lifestyle perspective to help PCOS? So when we come back to it, we're thinking about underlying factors. How do we control insulin and reduce insulin and lower inflammation in the body and lower androgen levels? Those are our underlying drivers here. So when it comes to lowering our insulin, blood sugar regulation is going to be so key. For one, thinking about our diet. So this is going to be a huge contributor to our insulin production. We produce insulin every time we eat carbohydrates, sugar, large excess amounts of food. Our body is producing insulin to help get that glucose and that energy and that sugar into our cells. But when we eat an excess or we have large dosages of sugar, of carbs, of food in general, our body over time becomes insulin resistant because it's been pumping out so much insulin to grab that sugar and put into cells that over time our cells stop responding to that insulin. And so we have high levels of insulin in the blood. We'll have higher levels of sugar then floating around in the blood, which is causing inflammation. So diet is going to play a huge role. Eating a whole foods diet is generally recommended in the research to support PCOS, to support insulin resistance. So a Mediterranean type style diet or anything that's really going to be focused on whole foods. And then looking at the composition of a meal. So a plate should include a protein, fiber, complex carbohydrates, healthy fats at each meal. Balancing these components on the plate will help reduce the sugar spikes, the amount of glucose that's uptaken at each meal, and provide more of a level kind of energy, a level influx of glucose, and allow our cells to respond more naturally to that input, as opposed to eating something that's very carb heavy, very sugar heavy, let's say like a donut for breakfast. It's going to be pure carbs, fat, and sugar. It's going to go right into your bloodstream. It's going to increase your blood sugar levels, and we're going to require a lot of insulin to get that. Also, eating a lot of excess food, so just eating more in general, is also just going to further burden that load of glucose and the breakdown of energy into our body. So eating within, our normal amount of caloric needs per day is sort of the sweet spot. Exercise, physical activity is also essential for supporting healthy insulin levels and regulating blood sugar. So typically the guidelines now recommend about 150 minutes per week of moderate physical activity spread out over the week, and usually including at least 2 sessions of strength resistance training. This one's especially important for insulin resistance. Building muscle has really been found to help support insulin resistance, so that's a really key thing to incorporate into a routine if somebody has insulin resistance. With exercise, it's also just about what someone's going to be able to be consistent with. So doing something is better than doing nothing. Often we're so sedentary these days. We're sitting down at our desks, we're sitting on the couch, we're watching TV, and the amount that we actually have to move day to day has really gone down. So being mindful about daily movement in addition to exercise is so important. That daily movement and steps is also going to be really important for supporting our insulin sensitivity. Especially there's research to show that taking like a quick walk after a meal can help reduce a blood glucose spike and help reduce our insulin level. This is perhaps, I find, the most fascinating area of all of this, and it's the circadian rhythm. The circadian rhythm is our master regulator of our hormones. We were built to live in alignment with the sun, okay? And many of us are not doing that these days. In the way that we're living most of our lives indoors, we're exposed to artificial lights, we have screens around us all the time. We are not as aligned with the circadian rhythm anymore. And this is disrupting our hormones and it's disrupting our insulin levels. In PCOS, we see patients have what's called a morning circadian misalignment. So naturally, we have the hormone melatonin, which we produce at night as it starts to get dark. And that's what makes us sleepy and go to bed. Then in the morning, melatonin production starts to lower and we start to have a rise in the hormone cortisol, which makes us feel alert and gets us up for the day and allows us to be alert and alive during the day. In PCOS, we're seeing this morning circadian misalignment. So the melatonin isn't being secreted at the right time, it's delayed. So people are going to bed later, and by the time they're waking up, their melatonin production hasn't properly fallen, and they have this shift where they're shifted into the day. And this is associated with hyperinsulinemia, high levels of insulin and metabolic dysfunction. We're not properly producing it these days because we're living in environments where we have lights on all the time, we have our screens on, we're watching TV right up until bedtime. So how do we correct this? Well, we start, for one, before we go to bed, winding down, turning off our screens. I say at least like an hour before bedtime is best. Doing things in low lighting, don't have your overhead lights on. Trying to get to bed before 10 p.m. is ideal, honestly. And then in the morning, trying to get out and have sunlight exposure in the morning. So you might have heard this whole thing about sunlight exposure. So why is that important? Because that sunlight exposure in the morning is going to prime your circadian rhythm for the nighttime. So getting outside, viewing seeing sunlight in the sky, having it reach your photoreceptors is going to help spike your cortisol in the morning, help give you alertness, and then by the evening time, melatonin production is going to be more aligned and sleep is going to be better, and insulin levels are also going to help be corrected. The gut is also playing a big role here. We see in people with PCOS that they have reduced diversity and altered gut microbiota. So their guts are not optimized. There might be leaky gut, so the permeability between the lining and the bloodstream is off, which is contributing to inflammation. All of this is going to be impairing overall health and plays a huge role also in our detoxification of hormones and elimination. So having a daily bowel movement is essential. Something, if someone doesn't have, I'm working on it with a patient. That daily bowel movement, having a daily bowel movement is where we are excreting the excess hormones. It's where we are promoting elimination of the waste that we don't want building up. From the diet side, fiber is so essential and so key for promoting those smooth, healthy bowel movements. So fiber-rich foods, fruits and vegetables. Think about all of your plant foods. They're all going to have fiber. Berries, strawberries, broccoli, asparagus, grapefruit. Trying to have a diversity of this in your diet is key. Beans are something I love and I often recommend because they're really rich in soluble fiber. They basically help bind the stool, they help bulk the stool and help get things going. Chia seeds, walnuts, flax seeds, these are also going to be really great binders, really high in fiber to get things moving and also feeding the good bacteria. And we do also have research to show that certain probiotics can help support PCOS, can help reduce inflammation, help improve insulin sensitivity. Stress is also always going to come into play here. Stress is going to further drive up androgen production because we produce more of those androgens from our adrenal glands. Strategies to improve stress can be such a range of things. It's really personal. I think some people love to exercise for stress. Some people do a grounding practice. I do think everyone can benefit from sort of down regulating these days and taking quiet time, taking breaths to kind of, I think most people are prone to kind of overworking, over socializing, overdoing it and struggle to actually slow down. But certainly that can vary. Like some people are on the side of needing to actually activate more and needing to get out and exercise more to reduce their stress. Focusing on stress reduction, always going to be essential. Sleep, again, is going to be really key for reducing stress as well. So 3 supplements that I really love for PCOS. Number 1 is inositol, myo-inositol. Myo-inositol has some really great research on supporting insulin sensitivity and helping improve ovulation rates, even in bringing down androgen levels. So it's fairly safe as well. It's also been helpful with fertility treatments for people who are using ovulation induction to incorporate myo-inositol as well. We have improved rates with it. Optimizing vitamin D, so getting vitamin D levels tested and supplementing to adequacy. Most people, especially in the northern climates, we're not getting as much sunlight exposure. And so you'd be surprised at what your vitamin D levels are. So I always say it's great to get your vitamin D levels tested, especially kind of midwinter. Vitamin D can help with inflammation levels or hyperandrogenism and even insulin levels as well. Also, omega-3 fatty acids have been shown to be effective and supportive for PCOS symptoms in terms of helping inflammation level. Omega-3s can also help improve the androgen kind of symptoms. They're great for supporting the gut health. Those are 3 options that I often jump to with PCOS. With making any of these changes, with lifestyle changes, it obviously takes effort and time, and that's where working with someone can be really helpful, or having like an accountability buddy. There is so much we can do to support PCOS, and I've seen many people go into remission. It's something that, if you have it, you might always be sort of predisposed to it given how you're living your life and what's going on, and you might tip into it at some point and then tip out. But really developing the strong foundations, those lifestyle factors, is going to be so helpful for not only supporting symptoms that someone might be experiencing with PCOS, but also those longer term health outcomes and risk factors that someone with PCOS is exposed to.